72 million Americans had CAT scans last year. That's a 500% increase from just 15 years ago. It is the most common diagnostic test, but it is also one of the least regulated. As Elizabeth Cook reports, that lack of oversight could put your health at risk.
I've been referred to as patient number one.
Michael Heuser's mystery illness started after going to the hospital for a stroke.
My entire body had welts all over it.
He suffered dizzy spells, memory loss, and a few weeks later,
I noticed that I lost my hair, in this band 4 inches wide around my head.
Barbara Darden suffered almost identical symptoms after her surgery at the same hospital.
My hair was coming out in handfuls up above the ear and around.
The common denominator, both had undergone CT scans of the brain. The bald bands around their heads were the exact same shape as the cradle of the CT scanning machine. The hospital, Cedars-Sinai in LA, finally admitted 260 patients had been accidentally exposed to a higher than expected level of X-ray radiation in 2008 and 2009.
My understanding is that I have received more radiation than an individual who was within 2 miles of the explosion of Hiroshima and Nagasaki.
An FDA investigation found the overdoses were about 8 times higher than normal and were likely the result of improper use of the scanner, which highlights what critics call a glaring problem. While the FDA oversees manufacturers of CT machines, there is absolutely no government oversight on how these machines are operated in medical facilities.
There has been basically an unregulated, wild west approach.
Attorney Rick Patterson represents many of the victims.
It can kill you. If it's dialed high enough, you can be dead by the time you get to the parking lot.
But extreme cases of overradiation aren't the only issue.
The day-to-day problem is the radiation is higher than it should be.
UCSF radiology professor Rebecca Smith-Beinman says a lack of national guidelines allows radiation doses to vary widely, sometimes exposing patients more than needed.
It can lead to an increased risk of cancer, but that cancer won't occur right away. It might not occur for a few years, or 5 years, or 10 years, or 20 years.
In a study published just over a year ago, Dr. Beinman looked at over 1,100 patients undergoing CT scans at 4 Bay Area hospitals: UCSF, California Pacific, Marin General, and Alta Bates.
The averages were actually twice as high as they should have been, and the extreme doses were 10, 20, 30 times higher than they should have been.
All 4 Bay Area hospitals told us they've made changes to keep radiation doses as low as possible.
We need very clear standards for what are acceptable levels of radiation exposure.
But Dr. Beinman wants nationwide low-dose standards. She's testified about it to Congress. As for accidents like the cases at Cedars-Sinai, industry spokesperson Dave Fisher says manufacturers have a fix, an alert system called a dose check.
Some CT manufacturers have already begun shipping new equipment with the new feature, and before the end of this year, all manufacturers will have done so.
But the fix comes too late for another round of radiation overdoses that came to light this spring at a hospital in West Virginia, leaving at least 20 more patients to worry about what their future holds.
I live with this anxiety every day. I go to sleep with it, I wake up with it.
Am I going to survive this? Am I going to die from cancer? How long will this take?
A law passed last year will require hospitals and imaging facilities to report CT radiation doses to patients and their doctors by 2012. Now, it sounds like a no-brainer, but believe it or not, that is not happening now, and there's still no move toward government regulation to keep radiation doses down.
It's incredible that it's not regulated.
No, and especially how expensive it is to get the treatment, and also, not the treatment, but the CT scan itself, but also how expensive the machines are, how there's no device to regulate how much radiation you're really getting, and if there is a malfunction, how to stop it.
Right. Well, hopefully soon. Elizabeth, thank you.